welcome back to the Babies in Common show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. As a reminder, any information shared during this show is not to be taken as medical advice. Please consult your own healthcare providers for questions about you or your baby's health, and visit babiesincommon.com/disclaimer to read more.
Great. And today is October 21st, and we're going to be discussing the TummyTime Method with its creator, occupational therapist Michelle Emanuel. And
Yay!
Michelle has more than 20 years of experience as an occupational therapist who's worked with babies in a neonatal intensive care unit as well as pediatrics, and eventually saw the need for a private practice where she also weaves her passion for anatomy as a massage therapist, cranio-sacral therapist, myofunctional therapist, infant massage instructor, and she's also a yoga teacher too.
Wow. Very well-rounded.
Yeah.
Well, I'm not a massage therapist, but that's the only thing.
I thought you were. Where did I get that from? Infant massage.
No, but even that is not a hands-on thing. You know, baby massage is really important. But it's sort of like that TummyTime method in a sense, because that's the original intent of TummyTime method. It has grown and birthed some other babies along the way, but the original intent was to teach a class and sometimes an individual session. We do a lot more individual sessions now, but of a group of parents with babies. And my favorite number is usually 4 to 6. And that's like, it's a nice big number, but you can also get to know each other, and to do sequential classes and equipping parents over time and watching it as the babies grow and develop too. And it's set up around the same kind of model of infant massage, where you equip the parents. And as a matter of fact, don't even touch the babies. Mm-hmm. The professional or the person that's trained has their baby doll and uses their baby doll to do techniques on, and then the parent is doing everything on the hands-on level, which we all know is very important. That parents, and because we can help them feel their confidence and competence with all of that, and it's through really easy, subtle ways. Because if we stoke those fires, all this other stuff's going to be a lot easier, not just in the moment with babies and pre-crawling babies, but just the parenting journey,
Absolutely.
Yeah, absolutely.
So, Michelle, you developed the TummyTime Method and trademarked it after you noticed there was so much more to having babies play on their bellies, and how integrating physiological and anatomical movements along with touch and play can impact how babies feed, digest, and connect with their parents and caregivers. So when did you actually trademark this TummyTime Method? When did you actually kind of create this spin-off?
It was about 15 years ago. I gauge everything with how old the kids are. Ella was about 2 when it became formalized. I mean, I practiced it by having a baby who my oldest is now 22. And I loved him so much. And I was an OT and I was a handsy person. And I just loved that kid so much. I just used my hands to do that. And I found myself doing infant massage and kind of learning on my own. And then I subsequently got trained because prior to having a baby, he's 22. I had become an OT just 2 years before that. And I'd been working on a pediatric rehab unit, traumatic brain injury and spinal cord.
Oh, wow.
So I was very talented and knowledgeable about certain things, but hadn't really worked with babies a lot yet. And I did follow another OT, and her name was Michelle, in the NICU at our teeny tiny little NICU at Methodist Hospital in Indianapolis, which was where I started my career. And I fell in love with the NICU, and I knew in my mind that's where I was headed somehow, some way. And I turned around, I ended up in South Georgia working in a hips, knees, and amputees unit. No, I'm just kidding around, but it was an adult rehab unit where there was a lot of just stroke and amputations and a lot of things like that. And it was an adult unit. And then I was doing a little bit of acute care peds and then a school system. So it was all spread out over a week. Wow. To imagine doing all of that work in 1 week now, I think I just,
right? Yeah.
That's you. Okay.
That's kind of like the way I started off in nursing, though. I did every floor of the hospital except labor and delivery because I really wanted to like explore nursing and prove to myself that, because I had that fire when I first saw a birth. I was like, I have to do this. Like you must have felt when you went to the NICU. This is what I need to do. So, but you danced around to different things first before you specialized in babies. That's what. So Jeanette, you took her tummy time method course. Is that right?
Mm-hmm. I did, exactly.
So let's dial it back. Let's take it back and kind of lay some foundation here. New parents often hear about tummy time. And so before we get into, more specifics about your particular method, can you share a little bit about the background of the Back to Sleep campaign and tummy time?
Yeah. So prior to 1992, babies were spending a majority of their time in a 24-hour period on their tummy, either sleeping, because that was when tummy sleeping was happening. And that all changed in 1992 when we began to wonder about whether that position was what was making a big deal. And so it actually really started Back to Sleep more in New Zealand, and then we took off, and then really it's a world global thing now about the Back to Sleep, and it's permeated almost all cultures on one level or another. But pediatricians knew, even in the United States, that with the implementation of Back to Sleep to prevent SIDS, which we can't really prevent anything, but to minimize SIDS.
Sure. Decrease the risk of sudden infant death syndrome or suffocation hazards. Mm-hmm.
Yeah, which are really two different things. And we could probably do another show, about that. But they also knew, though, that with changing the sleep position, because baby's primary occupation is sleeping and then feeding. Okay.
Although some parents would argue that those babies are not sleeping a whole lot.
Well,
but tummy time helps with that.
Barriers. Well, right. Part of the reason why we know Back to Sleep sort of quote works is because it does keep the stress levels a little bit elevated, and we don't really get into, deeper states of sleep, as a baby, unless of course we support them. And that's what we need to take compensatory measures like sleep sacks and some sort of containment that's not restrictive to movement, please, to help support the baby so that they can tolerate the sensory ability of being on their backs. Because what we don't remember as babies is that they're very susceptible to the electromagnetic field, and they know what position in space they're in, and their nervous systems respond differently given their position. And so when they're on their back, they're very prone to startling and stiffening and feeling out of sorts. And so we have to take those compensatory measures to help babies sleep in that position. But even in 1992, we knew, and pediatricians knew, that there was going to be a developmental backlash. And so at that same time, they brought out the Tummy to Play program. So they're actually twin sisters, and they emerged at the same time. The Tummy to Play did not get emphasized enough, which is why they had to circle back around. And by the time 2011, they came out and said, wait a minute, because of these changes, we need to tell you, because, head molding and flattening and torticollis increased like 400%.
Yes.
And that,
plagiocephaly, when the kids get the flat head, have to, my oldest son had, torticollis, and also had to be evaluated for a helmet. He didn't qualify, and it ended up working out, but it was a stress on us, to have our first baby. We thought, we didn't want anything to be wrong. So it sounds like they really pushed this Back to Sleep, but maybe but also Tummy to Play maybe didn't get as much fanfare, and that is a huge component because babies need that tummy time, right?
But a lot of people do say, like, when I say, has your baby been doing, how are you doing on tummy time, is sometimes what I say. And people are like, oh, we do it, but he cries a lot. He doesn't like it. And so I know there are a lot of families that know they're supposed to be doing time on the baby's belly, but the baby doesn't like it. So they limit it because it's miserable time. And what Michelle has come up with and taught so many of us is how to help the parents get their babies on their belly and make it not be time that they're crying. which
right.
is really
And I want to hear more
revolutionary.
about that.
Yeah.
But before we do that, why is it so important
Mm-hmm.
for babies to spend time on their tummy? So we know flat head is an issue. We know being able to move their neck, many different ways and not have, stiff neck. We know those types of things. People can see that. But there's other reasons why spending time on their tummy is important. Can you help parents understand why developmentally it's so important for babies to spend time on their tummies?
Yeah, we are very familiar with the physical things, and kind of circling back to the story about the pediatricians. They came out in 2011. They said, hold our horses here. We have to spend intentional time and tummy time. And by this time, it was several years later. And so we had kind of a little generation of kids who didn't spend a lot of time at all, on their tummy. And then when we came out and said, hey, we really need to do this, it wasn't clearly articulated to the parents how important it was for other things other than the physical. And yet the parents were coming in and still having complaints of digestive issues. And that's a big part of tummy time that not everybody thinks about. That's very, very important, and why so many of these babies have reflux and persistent reflux, and reflux that bothers them, and reflux that dysregulates them, and reflux that makes them stiff and tense, and reflux that makes them scared to move in the environment. And that has an impact, because development is like a ball rolling. It changes things in its path and it picks things up along the way, but it's totally rolling. And so if the ball stops rolling, things stop getting stimulated. And that means that the brain development is shunted in some ways. And so, it's really hard, because when we see babies, on the one hand, there's a no cry policy, by the way. Let me be really, really clear. In tummy time, we have a no cry policy. Now, that doesn't mean that babies can't cry, because sidetrack, and somebody you might want to have on the show sometime is Aletha Solter. And I don't know how much she's working now, but she wrote the book, The Aware Baby. And I've always loved her approach of understanding that crying, one, is communication. That's going to be important. Just from a whole parenting journey, I've found that communication's been the one thing that's been really important. And that starts right away, because another thing about the tummy time method is, and something that maybe people don't know that's good for them, is that it's about the social nervous system. And it's about working with eye gaze and vocal prosody and facial expressions, and orienting to one another and vibing on one another, and genuinely having a good time, almost like friends at a get together. And enjoying that type of relationship with your baby is really important, and it's important for the baby too. And babies aren't that sophisticated in thinking and cognition and making plans and thinking about the groceries. But what they are good at, they're sophisticated, is their social, emotional, interactional skills. And all those require, really good cranial nerve innervation, the muscles of the face and the tongue and the lips and the jaw and the neck and the shoulders, and how my tummy feels. And so one of the things we know, just looking at the research about prone, which is the medical terminology for tummy time, is that babies reflux less, and the gastric emptying is better when they're in prone. Okay, so these are for the really complex cases. And we know that gentle pressure and the wiggling and weight shifting and the things that happen in the core, okay, not just the abdominals, but the whole core, which is also the back and the spine and coming up to the tongue, will shift how the respiratory diaphragm, the pelvic diaphragm, get really situated. And those two things, kind of how they work, is how our digestive function. Yeah.
There's two things you said I wanted to highlight a little bit and have you explain a tiny bit more. So vocal prosody, what I definitely notice is that many parents don't know, especially first timers, right? They don't know that they could be louder and get their baby's attention and say and like change their vocal tone and really get their baby's attention. They're always like, oh, it's okay. And like, I'm like, your baby can't hear you. Like, say it louder, like, or go, oh, this is so fun. And then your babies are like, oh, okay, it is, and that gets their attention. So vocal prosody is so cool. And I love that, that expression. But also, so with digestion and reflux, so many parents say, well, we don't do tummy time because he spits up every time.
Right.
So what do you say?
Yeah. And it's the funny thing is that it's like the antidote to a snake bite is venom.
Right.
Okay.
Yes, right.
And I don't mean that in the ouchie way. It's, because we've found a way that's non-painful and no cry method. And so we can do it in this way. And it's really good because then we get the baby's buy-in and then they want to do it all the time. And that's really what they should seek and search for. A baby who's having an optimal sensory motor development seeks and searches for tummy time in all ages for their age. Okay. Starting very early on. And then by 5 months, they should be rolling, really consistently over to their belly, using their legs and their pelvis in rotation.
Yeah.
And then, by the time they're 7 months old, if they're not already crawling, you should not be able to keep them still when you're diaper changing them, right? Because
yes, right.
But there's two things.
My daughters
happen.
check on that.
There's two things that happen. I see parents who say, well, my 1-month-old already rolls over.
Yeah.
Not developmentally appropriate, right? That means there's too much tension. So we want to work on that. They also feel like, oh, well, and, I definitely want you to chat about like the phases of tummy time, but part of it is that you roll your baby into it and you roll your baby out of it. And it's not to teach them how to roll, right? Can you explain that?
I mean, it does end up at some
over
point.
time, for a long time, sure, but not like in the next week.
No. Yeah, and we're not even expecting that. But here's the thing. You're right. Those early rollers, because rolling developmentally is a segmental rotational thing, and it's come about through certain writing responses that are maturational in nature. So a newborn baby doesn't have the maturational skills of a 4-month-old or a 5-month-old, and no, they're very different. And that's really, we need to look at this first 12 weeks as a really special time of still gestating. And we know we've called it the 4th trimester for a long time, but we haven't really thought about what are we doing? Because what are the gestational influences in the 4th trimester? And these are things, that I continue to explore all the time. But, I think that when you're talking about vocal prosody, it's really something that people can understand. The word prosody is like, maybe you don't know that word, but you understand the richness, the tone, the intonation, the melodic features, these types of things, because we give ourselves away about how we feel through our voice. When we're very upset, when we're angry, when we're excited, when we're nervous, when we're scared. You can tell that in a person's voice. And the babies are very sophisticated in picking up on the vocal prosody. So this is one thing I think that, as parents, we get overwhelmed with guilt about, oh my gosh, if I feel any sort of anxiety or depression or anything, my baby's going to vibe on that and I'm going to ruin them forever. Babies are not thinking like that. Okay. Babies just want to hear you, that you're okay. They don't know your thoughts. They're not mind readers. They're just feeling your heartbeat in your respiratory rhythm, and they're listening to your voice. And so you're giving yourself away through your voice so you can trick your baby into knowing how zen-like you are. And I highly by singing.
And that probably would help you too, if you needed to pick me up.
Gosh. Yeah. Because the bidirectionality, the vagus nerve, which is our calming nerve, works both ways, and it loves when we exhale longer than we inhale. And so when we're singing, we're exhaling, and that makes the parent, on the other hand, it literally lowers their physiological parameters like heart rate, respiratory rate. And then the baby starts to calm. So it's not necessarily like try to tame the monkey parenting. It's just getting this physiological center that is more relaxed and calming. So exhaling longer than you inhale, making sure you're breathing through your nose. And if you have trouble breathing through your nose, then start digging around about maybe why, because it's a really important thing to do. And that's part of how we stay calm. And being a parent for 22 years now, you're going to need a lot of that.
Yeah. Well, that actually makes me feel better, because when I'm getting really frustrated with my children, I usually sing. And so maybe they don't always understand my words, but I'll say things like, I'm really frustrated right now that you won't let me change your diaper.
See?
I don't know whether it was my 16-year-old son or his cousin who's similar in age, but there was a night a few months ago that we were at a family dinner and there was a topic that came up. I can't remember what it was, but it was something that they didn't want to talk about. And so the cousin goes, "This is the changing subject song." And we were all like, "Whoa." And it was like,
Oh, that's
what,
funny.
you can still use that kind of thing when you're a teenager.
I guess so.
Yeah.
It works. Oh, perfect. I feel like I'm living in a Daniel Tiger episode, and parents of young children will know what I'm talking about. So, Michelle, as an occupational therapist, when you worked in the NICU and in pediatrics back in your first several years, what types of issues were you helping parents and babies with?
In the NICU, there's a lot for an occupational therapist to do. And I spent about 9 years doing it and I loved it. A lot of it had to do with positioning and alignment and how that was affecting breathing and how that either did or didn't promote sucking, swallowing, and breathing. What I was calling neuromotor maturation at the time. And I worked in the NICU that was at a large children's hospital, so no baby was born at our hospital. So everybody was transferred in. There's a difference between a NICU kind of level sometimes of a birth hospital, and then why they would be sent to children's would be an escalated situation.
Yeah.
Or surrounding counties that didn't have a go-to. They have a lot more of those now. But so a lot of positioning, alignment, and breathing, and feeding readiness, because we were looking at the maturation of coordination of breathing with sucking and swallowing, and what we call PO readiness, meaning, is this baby ready to take feeds by mouth? And usually, unfortunately, it meant bottle feeding. I wish it meant a lot more breastfeeding.
Because before that, babies, for those that don't know the NICU environment, before that, babies are getting either IV fluids or they're getting gavage feeding, right? They're getting a tube down their nose and throat, and because I think it's two reasons, right? Either they don't have the suck swallow coordination, suck swallow breathe to be able to take food by mouth, but also sometimes it expends so many calories for these tiny preemies to do that, that they just need to have the food put in their belly. Am I right about that?
Yeah, or that the baby's too young still. Because when you think about some babies that they're still 28 weeks, 29 weeks, 30 weeks, they're not even really ready to do that. And that's a maturational thing that comes on somewhere between 34 maybe and 36 to 38 weeks. But it's really variable and it's individualized, and it has a lot to do with a lot of different things. So that was part of my job. And even I love a multidisciplinary environment. That's where it was bred and born into me. We would stand around as a team in the morning and discuss what needed to happen. We had the bedside nurse, we had respiratory therapy, myself, social work, the fellows, the residents, and the attending, and the nurse practitioners just collaborating and going from bed to bed. And that's how I learned so much.
Were there lactation people there too?
Yeah, we were lucky in that our 2 registered dietitians were amazing people, and were both IBCLCs. And especially one, Amy Sapsford, who really is probably one of the most brilliant people I've ever met. I loved working. We had a great team. We had her and we had Dawn as a pharmacist, and everybody was on site, and it was really nice. And we worked very collaboratively together. But another thing, so the PO readiness was a big deal. And that was where I learned to say quality over quantity. And that actually became one of the theme songs for Tummy Time, because everybody was so over focused on how many, at the time we called them CCs, and they're now MLs, but how many CCs did the baby take? And, we would celebrate even, 3 CCs for certain babies. And because that was a nice, maybe set of 3 or 4 sequential swallows. But I kept saying there was no reason to wait. There was no reason to rush it. And so we wanted to wait and let the maturational come, but do the nurturing things. And I knew enough about that. I was really into, I had taken a class with Susan Ludington Ho, and I was very kangaroo care oriented. And this was the height of when developmental care products came out. And so it was very trendy to be working on this, and it was very wonderful. So there was a lot of that. And there was also, you know, consulting for whether we should consult with neuro or whether we should consult with another team to come in, you know, with, and I really felt very appreciated and very connected, and everybody was in that environment, you know, very good. So I really fell in love with that environment, and then just drifted over to outpatient to complete my 17-and-a-half-year career at this hospital. And that's where I got a bunch of babies that had torticollis and plagiocephaly and brachycephaly. And I had known about those things, you know, out there, but I was a NICU person. And so I had to get to know that end of it. And even some older children who had it, and, you know, picking up, you know, my thing was picking up the PTs who've been treating these babies for a while. They're like, nothing's nudging now. We want to help. And it was a collaborative, positive thing. Yeah. And because they knew at the time I was playing around with cranio-sacral and things like that, like what was really helping these babies. Because I noticed early on that the stretching thing was like not for me. And I could tell, like, from 10 feet, 20 feet, 100 feet back, that this was a no-go.
Because, and you mean like in physical therapy, the I think it may still be done today by some, but the idea of stretching a baby was what was typical.
Right.
And now, the more I learn, right?
Right.
Even now right?
Say what?
Even now, are you supposed to do that? I think it's moving away from that in PT. Is that right?
I hope so. I mean, I don't know, actually. It looks like it's still pretty strong, and it's still the standard, and it's the protocol, as far as at least as it's concerned within the academic institutions and the large children's hospitals and the downflow from that. I don't know. I think maybe many of us out in private practice are thinking a little bit differently.
Maybe that's the difference. Yeah.
Yeah. And I think you're maybe rubbing up with people who are thought leaders in the field. And I certainly hope so. But, you know, I teach a lot of classes, and I see a lot of wide eyes. Yeah. Physical therapists where, like, what do you mean no stretching? And what do you even mean by saying that stretching is a misnomer? You know, because that's part of it, it's a misnomer, because muscles don't stretch. You know, they contract or elongate. And that's based on neurological input, which is based on sensory input. So there's a lot more complexity to it, but of course that's the framework for it. And the problem with going back to sleep is that babies then spend, because they sleep so much, if they do follow that, then they're on their backs a lot.
Yep.
And that's not nurturing the digestive and airway system, nor the tongue position, posture, nor the parts of the brain that are responding to position and space. And we have to do so many compensatory things around that usually are inhibitory to movement. Then when we get to do the weight bearing and the challenge of learning about picking your head up and learning to move it in gravity is so challenging, because you haven't had the precursors to that a lot. Now, thankfully, a lot of babies won't let the parents put them down, you know, and if you really dig deep in my sessions, it's like, well, he's actually sleeping on my chest. It's like,
right. Which is essentially like, not tummy time, but it's sleeping on your tummy instead of sleeping on your back.
Right.
Babies are smart. They're going to try to get what they need anyway. And, you know, that actually makes a lot of sense now in hindsight with my 7-year-old who never let me put him down for a single moment.
Well, yeah.
So obviously this stuff is important, right? So like, when should parents be starting tummy time?
Well, right when the baby emerges from the vagina and they go through this extension and they begin to lengthen the spine and they push off with their feet and they propel into the world. The very first tummy time is the breast crawl. And everybody knows that in order to help a baby thrive, you put it on its belly on the mother, and it will locomote independently through a very complex and lovely set of movements that's independent and doesn't require, little nudges and mm-ms from the mom along the way, because we're not one thing, we're two. And so the reflexes will get the baby there through scent and even some vision. And That's the first tummy time. And then the first couple of weeks in the tummy time method is really on the parent's body. There's a lot of body contact over this, but we're also going to be very wary, obviously, of babies that have head turning preferences, right? So we're not just going to like, oh yeah, let's just let the baby turn the head to the left every time we're snuggling it up on our chest. Like, no, we're going to actually make sure the baby gets their head left and right, which is really nice. And also to work with a little bit of alignment and stuff. So we can really do some nice therapy things. And then even from time to time, if you have a baby that has a lot of oral dysfunction and is having maybe some squeaks or what we call stridor, these types of, or snorting or snorting or congestion or this type of thing, you want to get a little bit more intentional with gravity because we know that that helps the flow of things. And so when you lie the baby down for a tummy time, for a diaper change, or I like to say now a nappy change, then you can just roll the baby over for like just a few seconds to let the baby experience these positions. Because again, rather than it just being about physical, me as an occupational therapist, I really want to draw the distinction that it's about sensory motor processing, and the baby knows where they are in space. And this, especially the flat firm surface that we usually diaper our babies on several times a day, is a really good way, and a very small dose of therapeutic intervention can make a big difference. And then we just roll them right out and we pick them up and nuzzle them, with a clean nappy. And that's really the first 2 weeks. And then we go to having like this kind of dedicated spot where we have made it really nice vibes. And then we're going to do the tummy time method with the baby. And the big thing about having a method, and I wanted to say something about it, trademarked, people ask me, why did you do that? And that's kind of silly. And I say, well, the reason why I did is because it's a thing. Okay. And it exists outside of me. And I love that because it's just a little routine to follow. It's like learning a dance routine. And you learn the basic steps, and you do the basic steps for like a few days to a week. And then you get so good at the basic steps that you can then add on these fancy moves or your own personality, etc. It's kind of what tummy time does, because it helps the baby find their own individuality in movement, and it's very responsive. So it's also, even though it's kind of cookbooky, and initially it seems like it's very individualized, because we're watching the baby's subtle and overt body language and facial expressions, even micro expressions.
So I think that's helpful for parents, having like a method, like a cookbooky method, because you're so tired in the beginning, and tummy time seems like one more thing. And how do I do it? And now he's crying. And so to have something that has worked for other babies, this in this way, sometimes that concreteness can be really helpful for new parents.
What is worse for a parent, and I'll just speak for me as a mother, to hear is your baby crying? That is like, there's no other thing when you're postpartum or you're a partner of a postpartum person that you want to hear is really the crying. Again, we need to listen to, they said crying was communication, but crying is also for stress relief. And that's like the kind of the thing we don't really totally understand. That's when we've offered everything to the baby. And this is separate from tummy time. This is Aletha Salter's work. And we realize that the baby really needs a container and a place to communicate and to be heard. Now, because you've changed their diaper, you've offered all the things, you've tried to feed them, and they're still fuzzy. And a lot of times, because of the babies, we work with, there's a lot of gas and abdominal discomfort, because probably 9 times out of 10, and I've been treating babies for 24 years, it's why the baby's upset is there's something going on with the digestive tract. And because we're not getting enough of the ventral surface weight bearing, it's another word for tummy time or prone, then that's not stimulating our abdominals. And you can see a lot of babies have distended abdomens and what looks like abs that just don't even have any support really to give. Our transverse abdominis, which is our most innermost, supposed to be our visceral binder. And really hard to regulate your breathing if your abdominal area is not somewhat regulated. And that makes it really hard when you have to kind of work in aerobics to eat. Like that's what the suck, swallow, breathe coordination is. It's very, it's timed and it's steady.
And you're not saying when the baby is screaming like that, that's when we do tummy time.
No, that's totally separate from tummy time. Yeah, in tummy time, the most we're going to get, like what we call it, is when we roll the baby over, we're looking for what's called the peak of excitability, or like that time when the baby says, hey, if we go any further, I'm going to get upset. That's what we're looking for. And everybody knows instinctually when that is with people. If we have our eyes open, right? As soon as we see that, we're going to, roll the baby out. And
it's so key is the rolling them into tummy time and rolling them out of tummy time.
Right.
And I noticed that is when I talk to parents, like they're like, oh, I didn't know that. I just put them down and then I pull them back up. And I was like, let's think about this. And I love when I took your workshop, like how you actually had all of us lay down on the ground on a mat, and we actually had to pretend like we didn't have useful arms like a baby and try to roll ourselves back, and to notice what muscles of your face and head and what are you doing with your tongue, how that is affecting. And so I talk about that with parents all the time, like, have you ever done yoga? Or like, can you imagine like if you're in a push-up? Now, it depends. Like sometimes if I'm like, oh, you're 8 weeks postpartum, you can do this later when I leave. Or I'll be like, oh, you just had a baby 2 weeks ago, so maybe don't do this, but like think about it for a second, like, and they're like, oh, right. Yeah, that's even going to move my tongue a little bit. And I'm like, and there's all these muscles in your face and head attached to your tongue. So your baby's getting a big workout, which is also going to help. But if you were on your belly and a giant came up to you without you realizing it was going to happen and pulled you from under your underarms and pulled you up, you'd be like, no, where am I going? And that would ruin all the good muscular work you had just done in your workout on the floor. Yeah. It's just like so much of that makes sense. So like, be nice, roll them into it and roll them out of it.
Yeah, it's a transitional moves, right? Because one of the things about the tummy time method people don't know, it's really not just about tummy time. We've made a big deal of it because it's therapeutic. And babies need it, and we're in a back to sleep culture. But it's actually about more than that, and it's about all the positions. And we don't miss any body surface in tummy time. That's what I say. And it also is part of that optimal sensory and which will evoke, entice, arouse, stimulate, elicit optimal movement from there, because the brain's just there waiting for this input, but it has to get in there. And a lot of well-meaning parents don't understand that babies actually crave and need a lot of movement. A lot of what we think in our culture is that we need to support and protect so much and turn down the lights and other things. And like Jeanette was talking about, whisper, or speaking that lovely parent ease that we all love. But we can also, like when we're working on head turning with a baby for therapeutic tummy time, how I say in the training is like, call them like you're calling them for dinner. Everybody understands that. It's like,
I use that phrase. Yeah. Dad's usually like, really? Okay.
Yeah, people don't realize that in the womb, babies, the rush of blood through the uterine arteries is as loud as holding a hairdryer at arm's length, turning it on. So I mean, like, babies are not used to quiet. This is really creepy for grown-ups. It's creepy for a baby.
They're like, what's going on out here? Thought it was a party.
Or they're screaming loud enough already that they can't hear you because they're yelling.
Yeah, right. Yeah, exactly. So wait, some of the things that you really want to stress to parents with this tummy time method is, the transition, the rolling them into tummy time, looking for that peak of excitability, all of which I know that you talk about in your workshops, rolling them back out of it. So there's the transition. What if the baby rolls over on their own before 4 months, especially when the parents are trying to have them spend time on their belly?
Well, that's tension. And so we teach parents how to relax babies' shoulders, how to position their arms so that it's in a more natural position. We teach them how to use touch points to get the tongue in the right position, which will happen really because everything organizes around the tongue, whether it's functional and adaptive or not. So we want to, give it in there. And that's kind of the magic, of the whole thing.
Yeah, I've seen that work many times. And sometimes having other providers like a physical therapist or a chiropractor or a cranio-sacral therapist can add on to that. And depending on how tight a baby is, there's sort of a spectrum, might not be the right word, but like a step approach of like, oh, well, let's just try tummy time first. Or like, well, he's so tense that maybe you would need a chiropractor as well.
Like
You
what
sort of
Teresa Stewart,
say,
our sleep consultants, call the ladder of intervention, kind of like
right,
that, as you're
right.
describing.
Yeah.
You mentioned that you have your tummy time method. You stress it's a no cry method. So what happens if baby starts to cry during tummy time? Like, do you, have special strategies to helping make tummy time fun, or is it just the way that you approach tummy time? Babies are likely to cry less. Can you talk a little bit about that?
Well, crying is past the peak of excitability, so hopefully we never get there. And if
Got
we
it.
get crying, then we've accidentally missed it. Okay, and so we do need strategies how to pull us up out of the quicksand, and we do have those. But the real key is to the peak of excitability is that point before things. Now, based on temperament, there's a quick to react babies, they're going to go 0 to 80 in 1 second, and then there's a slow to warm up people, and they're going to take a while. So you got to get to know the babies. And also, I spend a lot of time, just basically observing, because in the NICU with our assessments there were observational based a lot of times, and looking at what we called, stress signs and signs of readiness, and using behavioral cues and body language to kind of make assumptions about what was going on in the baby's experience. Now, I was taking it another level, because even then I was working in the polyvagal theory, and that's what I bring forth, into the tummy time is, the piece from that is that all of these parts and pieces to tummy time are part of the vagus system, because it regulates movement and etc. But I don't want to get too, up in that, but, finding out a way to, like you're saying, give parents a way to follow along, and then they can also add their own little things is good, because there's a bunch of people that come and train for Tummy Time Method professionals, and they're very highly skilled people. And then, but they, when they become a parent, it just helps, like, somebody was saying, it helps me structure my day, around
absolutely.
interacting with the baby. And
instead of phrasing it as it gives me one more thing I have to do,
right.
it's something that gives me structure, and I'm getting to connect with my baby, and I'm playing with my baby, and I'm seeing the progress they're making.
So how many times a day
it.
should a parent be doing tummy time, Michelle?
That's a great one. Well, 3 to 5 is the generic. 3 to 5 times is the goal. And I really like short sessions. So you kind of, you're rolling them in and out a few times maybe, because sometimes you roll the baby onto their tummy and immediately they're like, eh, eh. So you just get them and pick them up. So tummy time itself may be 0.2 seconds that first time. So you'll do it again, and you can build on from there.
So it's like several times in a row with one session, but it's 3 to 5 sessions per day.
Right.
And it slowly gets to a point where you're spending more and more time if you add up all those minutes on their belly.
Yeah. And then eventually we can take a peek, because really, if we get the frequency, which is just doing it a little bit more, we don't want it to be overwhelming for anybody, because doing something 5 times a day can sound woo as a new parent. But when it's really very easy to do and easy to follow along, and it's fun, because parents want to know about their baby and they're keyed in and dialed in. You've got the perfect customer here to get them. All you're trying to do is get them to fall in love with them in this way too, and to give them the gift of intentional therapeutic tummy time, because we are in a back to sleep culture. The question remains, okay, if we were all sleeping, if the babies were sleeping on their tummies, would that do away with Tummy Time Method? And, probably not on some levels, because like you said, it's also just a nice way to work with your baby and have a framework, and then you kind of leave it when you don't need it anymore. But, I just think also too, let's just jump really quickly back to not focusing just on the physical thing, but on parents really feeling it. And that's what Jeanette was saying, like, there's something that they're really, it's the experience of enjoying your baby in a certain way and seeing things as problems to be solved rather than to get overwhelmed by, the issues. Because what we're not trying to do in tummy time is rush developmental skills. We're not trying to rush babies through this process. We're meeting them where they're at, and we're engaging these natural forces of gravity and all the sensory input, which includes vestibular. That's a sense that we have been hearing a little bit more about, and that's in the inner ear. That's why one of the reasons why we're rolling. But you're going back to your question of what if the baby starts crying, because there are babies that even when you roll them out, they all of a sudden then they get a little bit weepy. Well, one's called the movement medicine, which is where you hold the baby in a seated position and you go up and down.
So their butt is in your hand and your other hand is on their upper back wrapped around their neck.
Yeah. Kind of holding the baby in a seated position up in the air like Simba.
And it works.
If you're
so
Catholic,
well.
I was going to say, it's kind of like how the priest holds the chalice.
Yes.
You know, if you
it works so
that
well.
imagery helps people, right? We can see that.
Yeah.
But it's supporting. So the younger the baby, the more you're going to have their head, hold their arms, and the younger the baby, the older the baby, the less you're going to have to do all that. But their head, and they go up, and you go up and down, because that's getting access to the vestibular calming reflex, which just lets you also know how movement can be really calming.
Yep, nice and rhythmic.
Yes, exactly.
I actually had a dad tell me recently, I said, well, do you have a ball that you can sit on? He's like, well, yeah, but I've actually just been jumping. And he like demonstrated to me. and he like just jumped like 3 times in a row. Like he was pretending to hold his baby because he wasn't holding the baby at the time. And I was like, as long as you keep it rhythmic like that, sure, that can help you. You know?
So actually, there was something I also wanted to ask you about, Michelle, because Jeanette had brought it up on our last podcast, which was all about feeding babies. And she mentioned something about the oral rest posture, where how your tongue rests at the top of your mouth and if you think about it, that's where your tongue is right now if you have your mouth closed. Should be. So that's my question is, can you talk a little bit about tummy time and tongue posture deficits and oral rest posture?
Ooh, that's a great question. Well, many of us are hip to the biotensegrity principle, where the whole body is interconnected and the little parts are going to affect the whole, and the whole is going to reflect the small parts. And so for us, that's going to be the tongue, and babies, that's the epicenter of development. So the tongue is going to be, and we look at it from an anatomic perspective, the soft tissue connections go all the way down our trunk and our diaphragm and our pelvic floor and over our quads and behind our knee and down over our heel and to each toe. So we've had this saying, that the tongue is connected to the toes. Now, the body is one piece of material and can't truly be separated in any way. But there is a way to look at this connection and how babies move, and it's a whole body event when babies nurse. It's a whole body event when they move, how they experience the world. It's a whole postural synergy. So it's very easy to look at the feet and kind of see even what's happening in the mouth and what's going on up above, because it's going to be a reflection. But if you think about it, the babies, in the utero are tucked in and they're flexed and their shoulders are high and elevated. And when they come out, that's their first extension, and they're lengthening the neck, and they begin to open up the shoulders. And this is where we need to be, with the breast. We want the babies, have their arms out. Many of the babies are like
crossed arms across their chest.
Exactly.
And down. So we have to work harder with them.
Well, and that's because they haven't spent enough time doing weight bearing with an open posture and unfolding the body's natural unfolding. And babies with tongue dysfunction are going to have more trouble with that. But the tongue being connected to the toes, if you think about it, they're like this. And so when we go to extend that, it asks for elongation of the tongue and the anterior neck, which that's like, we don't have it. Okay, that's for tongue time. We don't have the length, okay? So tummy time becomes super challenging because you're fighting against the forces of not having enough cord. I was trying to put my
So you're saying that babies that are born with a tongue tie might have trouble with tummy time, even though tummy time might benefit them because they're tongue tied. So how do you get through this? So, and those babies might not be able to rest their tongue on the top of their palate, like you were saying.
We can get it to happen. We can get it to happen. We can get any baby to be optimized. And this is the problem. We can't just look at a baby and say, you must be functioning your best. No, they're not.
Right.
Okay. And we can get them to do that. And that's how another way the tummy time got a little bit more solidified, because what was always a part of the tummy time was the rolling in and out and lowering the baby down and rolling the baby in and out based on this peak of excitability. So that really was like, and then it grew to have the 8 phases because it needed to have a little bit more delineation, and because of the tongue tie babies, it kept showing up. And they have another challenge, because any problem a baby's having with difficulty with tummy time is going to reveal some sort of functional deficit, because the natural innate instinct, if you watch a baby that doesn't have those things, they do very different things on their tummy, and they enjoy it immensely.
Mm-hmm.
So we know that not liking it is a sign and a symptom that they need, because there's one thing to just tell somebody, oh yeah, your baby needs tummy time, go do tummy time. And that does not help a parent. But if you say, I can teach you how to do tummy time so that it is not stressful and that it's fun and enjoyable, and you're going to notice amazing changes. That's what parents really need and really want, right? And just as a parent, that's what I needed too. And I sort of created what I thought, I needed too, is, to be supported as a young mom. And I think back, like, you guys, my kids are so old that we didn't have Facebook when I was young. And you know what? I'm glad. I'm glad, because I would have probably been too tempted to overuse it.
Yeah.
Not just with myself, but maybe with the kids too. I mean, we didn't watch any TV, because I grew up in the country and I knew TV was bad, right? I always had the TV. We didn't have a TV for 10 years growing up. I really,
wow.
Yeah.
You must have read so many cool books.
Oh, I've read a lot. Yes, read a lot.
Michelle, and you and I were born on the exact same day, same year.
We're getting ready to turn 50.
Yeah, I know. But yeah, you're right. Like, just the way we had to parent. I mean, your oldest is 2 years older than mine, but like the way we had to parent, like there was no Facebook. We actually had to talk to people and get together and play with our kid. And eventually, maybe when they were like 3 or 4, there was some TV programming that was perceived as, okay, this is a little bit more educational. We can do a little bit of this, but it's a lot of music, a lot of different things than now. There's the distractions for the parents are just totally different now too. So this, I think, is a really great technique to help parents tune back into their baby. There was a favorite moment at one of the conferences, the lactation conferences I went to years ago. And an older lactation consultant who's been around for a long time, she held her phone and she says, and she starts stroking her phone like you're scrolling, and she goes, phones these days get more touch than babies do.
I know, we have to touch.
And we were all like, "Ooh, that's so good!" Like, it's not supposed to be that way, but yeah,
it's not supposed to be that way. And actually, this has been really on my mind today, just with the clientele that showed up today, and I felt very inspired to even post about this on Instagram. I was talking about how, people want to say, "Oh, you're going to spoil that baby," or "Am I going to spoil my baby?" and stuff. And I'm here to say, like, it's not about the outcome 10, 15, 25 years from now. Babies need to be rocked and swayed and walked, how babies like to have you walk. And they need to be in contact with the maternal, paternal parent body. And, they need to have very little to no movement restrictions. Now that's where we get into problems with this being on our back so much, is that babies, that's not a regulating position.
And there's so many containers you can purchase and that people buy for you for your baby that we think we have to put our babies down all the time.
Right.
And we really don't.
No.
So that actually is a good segue to a question that I had about baby wearing, because I feel like baby wearing is a great thing for bonding. It's wonderful for learning your baby's feeding cues, practicality, getting, being able to get something done eventually, although hopefully not in the first couple of weeks. You're just resting, because resting from pregnancy and birth is a full-time job. But I have heard some people say things like, "Oh, don't worry, you don't have to do tummy time if you baby wear." And I understand that that's not exactly true. Can you talk a little bit about why tummy time is still important, even if you're a baby wearing parent?
That's such a great question, because we can look at it from many different ways. And I'll give you my short version here is, one, I love it for all those things that you mentioned. And having the close proximity, the safety of the parent, it's really good from the baby's perspective. It's also because they feel the rhythms of the parent's movements. And it's not a coincidence that we mimic each other's gestures in families, because we're living it and breathing it. And it also gives the baby a really quickly expanding view of the world, and the psychology that follows that's really important. And the baby can smell. It's all these different safety things. So it's on that level really good. What it doesn't provide is, a lot of times, because the wraps are pretty snug, it holds the baby in close proximity with the parent's body. So the baby's not really using a lot of their own strength for maintaining their posture. Now, hopefully their muscles are sort of mirroring their parents a little bit, and they're, engaging, and they're feeling these subtle postural shifts, but it can be a little bit more challenging if there has been an oral restriction, or there has been uterine position, or the baby's not moving really well. So it's not going to be an issue at all for babies who are optimally moving and have optimal feeding, just to say that. But then also sometimes what I see in the carriers is that the babies get this kind of tip back position of the head, and they stay in this kind of sniffing, stargazing position. And everybody knows I love this position because we call it guppy, right? But it's not. This is a different thing when you're up against, gravity, and there's a postural thing. Then you should be like this, and you should be using this sort of automatic muscle tone ability. I mean, we shouldn't have to fight and work for our postural control. It's part of our autonomic body, and it happens really quickly. We want that to
have
develop.
Your head resting straight on your shoulders, not leaning backwards, you mean?
Yeah, because in a way, this can artificially open the airway, and the baby usually has their jaw open as well, which interferes with the oral rest posture.
Right.
So it pulls the tongue down, and then there's all kinds of compensatory things. And so then the baby can really develop some harder habits, because babies aren't supposed to be in the vertical all the time. And when you have a little trouble with it, then you start to see them drooping. And I just say, wear them until they're drooping, and then get them at horizontal. Let gravity have a little effect, and let the surface have a little bit of impact, or put them on your body and you get totally flat, because different people prefer different things. One thing though about TummyTime method is like, the baby's never alone in TummyTime, and it's just as connected as holding your baby, because you're like holding them, and you're all over them, you're rolling them in and out, and you're touching them, and you're interacting, and it's very co-regulated, and it's an experience you have together.
You can massage
Wow,
them
some of it can be, say again?
You can massage them at the same time, sing with them at the same time.
Yeah, and add your own little jam. Like, I love reflexology, so I love to add reflexology points and to do some really simple ways that can help tap in, to relaxation. But the oral posture, as the tongue does belong on the roof of the mouth, and there are a lot of barriers to that. And that's going to be something you'll see with babies who have trouble with TummyTime, because it requires that this area to be optimized, and very often it's not, from a movement perspective.
The area, under the tongue and the throat, you're saying.
Yeah. And let's, get our mind out of the fascia for a lot. Let's spend most of our time out of the fascia, because what fascia does is responds to the loads. It adapts to the loads. So many of these people who are, even getting tongue tie releases, and they're like, I don't understand why my baby's tongue tie grew back. We have the best release provider. We have the best lactation. We have the best of tea. We did all the wound care. So why? Is because the body did not adapt, and did not change, and not move enough. And there's not enough forces to have it adapt to that load. So it just, kind of goes back. And that's what also I'm so excited to tell you about that TummyTime does, especially for professionals. It gives you a barometer for how intense to make it with babies to make therapeutic change. Because that's the one thing we don't understand when we're working with babies is, like, we know they need to change. We know they need to exercise. We know they need to get stronger. We know they need to improve their endurance. We know they need to move their tongue better. But how do we do that without overstimulating them and stressing them out? So that's what the lens of TummyTime method gives us, the ability to know how well to modulate that.
And I use TummyTime I know you talk a lot about this as well, the optimal timing. So if there is a baby who might possibly need a tongue tie release, that having parents not rush into it is really important. We want to make sure that all those other body muscles are ready for that. And that sometimes just in some cases, just by doing tummy time and maybe adding in some massage and some facial and some oral activities that are all playful and all gentle, sometimes you can actually get to a place where feeding is fine and good and everything is looking better. And now you don't need a release, or maybe you don't need it yet. You could wait a little while, you could read more about it, you could learn more about it, you could think more about it, and then there's other times where everything is looking pretty good and the tongue is attached to the tip. So maybe we could do that quicker than for someone that might need. There are times where I'm like, within the week, okay, I could be comfortable, but I really want you to do the following things for 3 or 4 days at least. But then there's a lot more people that I'm like, I really don't even want you to go to one of those specialists for like 3 or 4 weeks. There's a lot of other things I want you to do. And we're going to reassess before you even do that, because of all the work that you've done to explain that to so many of us, to help us figure out how to help parents so that they're not in a situation where they get a tongue tie release done and it's by a wonderful provider, but the body wasn't ready for it.
Right. That is so important and so key. And, I know that I'm the one that kind of developed this and focused it, but just so you know, like the babies taught me and I was willing to listen along the way. But a big part of it is I feel sorry for any baby going through a tongue tie release without TummyTime Method, because there's nothing really like it that actually gives us a way to look and measure and see change and work at the baby's regulatory level, and also then challenge these areas to work more or better, more efficiently, innately, naturally, reflexively, and then even volitionally. And I totally agree. And I'm happy to try to get it in as many people's hands as possible so that, we can really help parents, and it makes a big difference. And it's much more than just, again, doing tummy time. It really helps really condition. I use that word kind of loosely, but we all condition ourselves to certain habits, but conditions our nervous system how to handle challenges, how to get through barriers, and not just developing postural control, but anything in life. We become more resilient. We become more regulated. We can bounce back. We can do things because we've developed the proper neural circuits to support that, with regulation. And there's so many things that are unique and important about this pre-crawling period that, I always say, like in TummyTime Method, we take a magnifying glass and look at each of these stages in the pre-crawling period, because each one of them is important and they build on one another. And they don't just come automatically because the baby ages. It's sort of like dominoes that trigger off maturational processes. And in order for that to happen, we've got to get the right sensory input in. And in a diet of containers and swaddling and having improper oral rest posture, that we learn and do more of what we do.
Sure.
It gets harder and harder to change the maladaptive strategies. Even in a 6-week-old baby, it's really hard to help them learn to breathe differently. I mean, it's totally doable.
Yeah.
But it's a challenge.
It's so interesting. You're reminding me the way you were just talking about that. It's sort of like, I think we get acculturated to feel like we don't really need to teach our babies much until they go to school. or until, we're teaching them to walk, or we're teaching them to eat food, and we're teaching them, like there's a few things, but not in the world of baby, that early baby. We don't think like, oh, I'll have to teach my 3-week-old something. But there's a lot you can teach them. They're soaking it up. And some of it is intellectual, and some of it is really based on so much sensory input in all sorts of ways. And tummy time adds so much to that. So we're talking about classes. So I want to give people an opportunity to figure out where they can find you and learn more.
Yes.
So TummyTimeMethod.com.
And that's the main website.
You've got 2 really good Instagram handles. So at TummyTime Method, and then there's, what's the other one?
Tongue Tie Babies.
Tongue Tie Babies, right? Yeah.
Now,
post.
What's happening with classes right now is, it's really hard. And I work on inspiration and not perspiration, even though I love to sweat in my yoga. But my creative work has to come from inspired, and it's really been hard this year in 2020 to get excited about teaching classes, but I am migrating to virtual teaching for TummyTime Method, and that'll be available in early 2021.
Good.
And I'm excited to do that, because I know that people who could not access it before will be able to access it now, and it's going to be a lot more helpful. But it's just really hard for me because it's sort of like my own baby, and you know, kind of letting it go out there in a way that's kind of, it's just interesting, you know, leaving the nest in a way.
Well, I'm glad that you're letting so many of us fly with it. And
yes, I agree. So
it may not be
TummyTime
perfect,
Method,
but
yeah, I know that's me.
TummyTimeMethod.com.
Like, it has to be perfect. It doesn't.
I try
And
my
I
best.
would encourage anybody who maybe has been inspired during this podcast by, oh, my baby kind of sounds like that, or oh yeah, we struggled with that, or you know, to consider going to TummyTimeMethod.com. I also wanted to just run down, we've talked about so much in this podcast, but just as a nice wrap up, these are different things that TummyTime Method can help with. So if your baby struggles with any type of postural asymmetries like torticollis, or having a head preference turning to one side, or feeding on only one side preference, any type of cranial molding or head flattening, oral restrictions like tongue, lip, and buccal ties, any type of the big R, right? Reflex, colic, quote, colic symptoms, GI issues, fussiness, stiffness, body tension, oral rest posture, you know, thinking about babies who are having trouble with suck swallow, breathing, snoring, squeaky, the constipated rhinoceros babies. If your baby was premature, as a labor and delivery nurse, I would say if your baby had any type of instrumental or operative delivery, cesarean babies, forceps, vacuum, you know,
or if their
these
hand
would be
was up by their chin when they were born.
Right. Compound presentation. These are all things TummyTime and TummyTime Method, the way that Michelle has developed to teach TummyTime, can help all babies, but there are so many babies that suffer, and so many parents that suffer because their babies are suffering with issues like this. You know, like Michelle, you said so eloquently, your tongue's attached to your toes. Everything affects everything else. You know, in labor and delivery, I always say your tight neck, tight cervix, right? So like if you're tight up top, you're tight down below, and you're speaking the same language, but for babies. So please check out TummyTimeMethod.com to learn more about Michelle, her classes, virtual classes coming up, and about this incredible resource for you and your baby.
Well, thank you so much, Michelle. We know you could talk about this for hours. We could talk about it for hours, but at some time people need to go on to other subjects in life and move on to other things and take care of their babies and go practice tummy time. So
exactly.
It's been so much fun. You guys are a fun duo, and
oh, thanks.
I appreciate the enthusiasm, because you know what? It's hard to balance helping parents notice some of these things and not get overwhelmed or get worried or think that we're saying that their baby isn't perfect, because they are. Babies were, you know, they definitely are, but this unfolding process from our in utero position is something all babies are doing. And we just need a little bit of help sometimes. And the culture, because of back sleeping, is, you know, it's a little bit against us. So we all need a little bit of help, just like anything. And that's what I've really appreciated, you guys noticing that it is really more about something to just implement in our lives and enjoy it as a unique early parenting experience.
Yeah,
absolutely. Well, thank you for coming on the show.
Yeah, I think another idea for you, Michelle, now that I'm thinking about what you're saying, you know, adults benefit from being on our bellies too. So could you just do like a fun little thing where you take your yoga training and do tummy time for adults? Even if it's just like a 5-minute thing that parents can do every day for themselves and all adults can do, I think that could be really interesting.
Yeah, and it's really important because you guys know in COVID times that they had the whole proning teams.
Oh, right.
Yes, right.
Groups of therapists who would go.
You were dancing around your office going, woohoo, tummy time for adults. Look at that.
Yeah. Where they had teams of people going in and putting people on their tummy because they breathe better.
It's helpful, right?
Yeah.
And actually, you know, when we're, you know, in tummy time, it's more advantageous for our tongue position too. And that's and
nursing on their belly too is really a great nursing position.
I think that was a wonderful way to end this show.
Yeah.
I think if anything is going to capture someone's attention, that right there was just like that $1 million moment. Like we are turning people with COVID on their bellies
Yes.
because it helps them breathe better. Breathing is
Yeah,
essential to
it's a good
life.
thing.
Oxygen is life. Let's help our babies breathe better, live better, feed better, feel better by giving them these experiences that they need to develop properly.
You're
So
so
that's
good at the
wonderful.
wrap-ups,
Thank you so
Melissa.
much.
Beautiful.
We hope that you will visit babiesincommon.com/show to view all of our previous episodes and see what we have coming up as well. And as always, our show is available as a video recording and as a podcast. And I do actually encourage all of you, if you can, to consider when sharing this video, share the video, because Michelle, for those of you that are listening on the podcast, was doing so many great body movements as she was talking about stretching and elongating in babies. I think it adds to this podcast for sure. But we're also on Spotify and Apple Podcasts. We always appreciate positive reviews and sharing this podcast with friends and family or any new or expecting parents. And our Babies in Common website and Facebook page are other ways to learn about groups and classes and services that we offer, as well as plenty of tips and resources to help you rock your birth and thrive as a new parent. And why is that, Jeanette? Why do we do this?
Because as always, Babies in Common is a community for you. Because we all have babies in common.
Thank you, Michelle.
Thank you.
Thank you.